Well, hey everybody, it's Sandy, and welcome back to my channel dedicated to helping you advocate for your own health, one topic at a time. So I saw I have a few new subscribers since the last time, and thank you so much. I was so happy to see that. Happy you're interested in the content, and if you're not a subscriber, I hope you will subscribe. And of course, please share with anybody you think might find my content helpful. Yeah, so today I want to talk about routine healthcare in the time of coronavirus when nobody wants to go to their practitioner because we all want to stay away from these medical offices. Yeah, so it's kind of scary. What if, you have a routine thing like every 3 months, every 6 months, you go see your practitioner for, you're on medication, whatever, you have a condition they have to follow pretty regularly. Yeah, so my thoughts on how to handle that. First of all, rest assured that these places all have, different policies and procedures now in place with this pandemic in mind. So it doesn't need to be quite as concerning as it is. But of course, it's scary. So, I think this breaks down into two categories. The first thing is, can you do a telehealth appointment? We'll talk about the expanded role of telehealth. And secondly, what if you can't, and what are my recommendations if you absolutely do have to go in to your practitioner's office? Yeah, so first of all, telehealth, wow, what a time. Boy, I wish I was a developer of those platforms. There's a widely expanded role for telehealth. It's if you can just call your practitioner in advance and ask if, I've got a routine visit coming up in a couple of months. I'm wondering if I can switch that to a telehealth visit. You might also want to be able to say, by the way, I have my own blood pressure cuff at home. I can take my own vital signs so that, that doesn't become the rate limiting step. There are lots of easy to use, cheap monitors you can buy on like Amazon, blood pressure monitors that are real easy to get, easy to use, and you just don't want that to be the issue, the stumbling block. So yeah, you'd call up, you'd ask, say, I have all these things that I need to take my vital signs. May I do this by a telehealth visit? You'll need a smartphone. Some of them are using platforms with a computer, with a webcam, but usually it's done via a smartphone. And this might be a good time to say, if you've got anybody that you love who's elderly, and a lot of, people are, if they're elderly, they're not really as comfortable with some of that technology. This would be a really good time to try to get them comfortable with the technology, because elderly people, being more vulnerable, are the people that really shouldn't be going out into these places. And if somebody who's you love is elderly, that can make an appointment as a telehealth appointment instead of going in to see a practitioner, that might be tremendously valuable. So what happens if you just can't do the visit by telehealth and you have to go in? So here's my advice. There's a few things to consider. Again, I think that you can take great comfort in that medical offices, practices, hospitals, they've all instituted now all kinds of guidelines. But that said, it's still important to advocate for yourself. So first of all, I would ask if I could get a first thing in the morning appointment. Now, if I can't, I can't. But, all things being equal, I feel more comfortable with a first thing in the morning appointment. Nobody's been in there. It's not, you haven't had to make sure they've cleaned everything. In between you and the last patient, it's been several hours instead of several minutes. Even better yet, can I get first thing Monday morning when the office has been sitting empty all weekend? Maybe. But you can't do that. You can't do that. And even if you can, you still have to, be aware of guidelines that are in place, and they still have to do everything else correctly. So I would ask, get on the phone, say, I'd like to speak with an office manager about, what precautions you have in place right now to prevent the spread of disease. And this is a very common question. You shouldn't feel concerned asking it. The answer should roll off their tongue. They should have something in place that's easy for them to discuss and talk about and relay to you. So what should that consist of? Well, there should be some sort of a filter to getting you into the door. You shouldn't be able to just walk into the waiting room, okay? Shouldn't be able to just walk in that building. They should have somebody who's outside the door doing temperature checks, or somebody doing some kind of screening. Sometimes they say, well, somebody's going to come to your car. Sometimes you have to go walk up to a table. Whatever it might be, there should be some sort of screening. Sometimes it's even calling you the day before, and they're going to ask you if you had any recent fevers and things like that. But some way that they screen, because they tell you that way that they're concerned and they're being careful about who gets in there. Now, you're going to want to make sure to follow all the social distancing guidelines. So if you do have to go get in line, stand at a table outside the door on your way in. Don't get right up behind the person in front of you. And likewise, don't feel bad about asking somebody who's behind you to back up a little bit, okay? If you're trying to observe these social distancing guidelines, that's what you should be doing, and they should too. There should be something in place where you can observe social distancing guidelines once you get in. So they might say, well, we're only filling up our schedule to 50% capacity because we don't want too many people in the waiting room at one time. They might say, we're going to have you wait outside or wait in your car, and then we call you when we're ready for you to go back into an exam room. You're not going to sit in a waiting room at all. To my mind, that's ideal. And if they're not doing that, I think I might ask, may I wait in my car? Even if they are having you wait in a waiting room that's, not crowded or anything like that, I think I would still recommend saying, may I wait outside? And I'll have my cell phone on, just call me when it's time for me to go to an exam room. And usually they're accommodating. They will probably they should tell you that their employees are all wearing masks. They will probably tell you they want you to wear a mask. Both those things are good. You will want to ask about, is there going to be anything where I have to sign in, or anything where I'm going to have to sign a paper, or most of them have gotten away from those touchpad kiosks because they're just germ petri dishes now. But some of them haven't gotten entirely away from having you sign something. So the reason you're going to ask that in advance is because you're going to want to know, the next question is, do you have a hand sanitizer available right where I do that? Okay, because if you have to sign a form, even if you have your own hand sanitizer with you, you don't want to take their clipboard and their pen that everybody else before you has used and then give it back to them and then go digging in your own personal stuff with those dirty hands. No, you'll want to make sure that there's hand sanitizer right there. So if anybody asks you to fill anything out or use a pen or touch anything, make sure that there's some hand sanitizer there before you do it. And in order to use it correctly, you're going to pump enough onto your hands that they will remain wet while you're rubbing them together for about a good 30 seconds. Yes, it's drying and it's uncomfortable, but that's how it's most effective. The other question you're going to want to ask is about exam rooms, exam tables and equipment like blood pressure cuffs and things like that, and ask, is that wiped down between patients? And they're going to tell you yes, and they should. But again, you're going to be the eyes and ears when you're there, and you're going to advocate for yourself. So one thing about medical practices is that they're just like any other office place. It's a workplace filled with human beings, and where there are human beings, there are human errors. And so you're going to be watchful. You're going to want to look around you and ahead of you. So let's say they come to get you and they're leading you back to an exam room, and you're on your way down a hall and you see somebody off way out ahead who's not wearing a mask. You're going to want to stop. You don't want to get any closer. You're going to stop and you're going to say, you guys are all going to be wearing masks, right? Or say something. Just say, is that person going to put a mask on? It's most likely just, an innocent mistake. They'll put it on, they'll correct it, and you'll feel more comfortable now that you have to proceed down the hall and get past that person. And same thing when you get in an exam room. Yeah, you've already asked about the blood pressure cuff, but when somebody takes the blood pressure cuff to come over and put it on you, just ask, do you mind me asking, are these things all wiped down in between patients? The probe that goes on your finger, there's a little probe that sometimes they put on, it checks your pulse and your oxygenation. Yeah, fingers are a whole different standard in my mind. If they put anything on my fingers, when they're done with it, I'm just going to say, I want to wash my hands, if you don't mind. So either, again, with the hand sanitizer, or if you're in an exam room, there's probably a sink with soap and water, which is even better. And I would wash my hands after that. So those are my short and sweet tips, tricks, precautions, the things that I would do to make myself more comfortable as much as I can. I think to a large extent, it's going to have to do with how comfortable you can be advocating for yourself, not worrying about speaking up and not worrying about asking these questions. And I think that will go a long way in terms of helping you have an experience that you can walk away from feeling like you were as protected as possible. So I think I have a couple of nurse practitioners that tune in. I'm not sure who everybody is, but I'd be really interested in hearing in your own offices and workplaces what you're doing, and any tips or tricks or things that I didn't that things that you disagree with or things that I didn't cover. I'd be certainly willing to hear. And yeah, I want to hear everybody's experience. Okay, if you've been a patient with an experience, please. Very interested in that. And I'm not really talking anything about hospitals right now. I think I might do a different video on that. What if you're really sick, or what if you have to be in a hospital right now? That's not really for the scope of this video. Anyway, if you're not a subscriber, I hope you will be. I hope you'll share with anybody you might find this topic helpful. And until next time, bye-bye. Be well.